Stillwater's Morning Scramble. Glad to have you here at 7:45. Shyla Eggers is in. Good to see you.
Good morning.
And I'm seeing you early in the morning now.
I know.
You're going to get to where you really like these.
I don't know. Mornings are tough for me, but no, I love to come in, so thanks for having me.
Well, in your days, I wouldn't even want to guess how long your days are right now.
Well, there have been some long days, and there's a lot of people having some long days, but we're just trying to make sure that we have everything covered the way it needs to be covered and taken care of. So there's a lot to do, and so each day is a new day.
I'm sending a note to Christy. I should have done that before, but she's welcome to call in. I think that's what she told you, right?
Yeah, she told me on
that she'd be calling in.
She'd
so
be
Christy
calling
Morrison,
in from her office. Yeah.
So she'll be calling here in just a little bit because you guys had a good visit here. But I corresponded a little bit yesterday with Scott Petty, and he's been great, and you've been great about keeping us up to date on what's going on.
Right. We're doing our best.
And the one thing, because the rules are changing somewhat. And the thing is, we can't lay it off the gas, can we?
I don't think so. I mean, we have got to be diligent about distancing. And Christy and I talked a little bit about the number of people we see in stores not wearing masks. And I've mentioned this before. Wearing the mask is not necessarily to protect you as much as it is everybody else. You could be a young, healthy adult with being asymptomatic, and you don't want to give that to somebody who's in the store with you. So the win-win is that everybody has a mask, and we're protecting each other, and we care enough about our community to do so.
Are you styling with your mask?
I have a nice medical grade mask in my car.
That's styling.
When I'm not driving, and I put it on, or otherwise it hangs over. It's like when you used to hang the dice over your mirror in your car. Now I hang a mask over the mirror in my car.
I only wear mine when I go into a store, but I always wear it in a store. I'm not going into stores very often, but the good thing was the last time I didn't was probably 3 weeks ago, something like that. And I thought, well, I'm just going to run in, and I just forgot to bring it, right? It wasn't in my car, and when I'm on the air, we're safe distancing. And I thought, well, I need to stop in here. And because a lot of the people were, I knew I was in the wrong.
Right.
Does that make sense? You feel that
peer pressure.
And that's a good thing.
Yes, it is a good thing.
You go, okay, I'm embarrassed by this.
Right. Yeah,
and
I should have this on. And I told Christy earlier this morning that I had to run into the store yesterday just to grab cat food and a couple of things, and I was shocked by the number. And I got in and out as quick as I could. I got the things I had to have. I didn't go on a shopping spree. But there were people in there with full families with them, with no masks.
Yeah.
And I don't understand that.
I've seen that
if you need to go to the store, just one of you go, Don't take the whole family. And these were kids old enough, again, they were plenty old enough that they didn't need to be in the store with them. So it scares me a little bit of how lax some people are right now.
Right.
So.
No, I agree. And I'm very thankful. I know they've kind of pressed the point, and they've done a lot of good things. Walmart's given back and stuff like that, but they kind of had to make that a rule. But I'm glad that they went, because the optics of it, to me, when you walked in and they weren't, you'd even almost see the store manager and he wasn't. It just seemed like, and they're here all day.
Right.
I'm only in there 6 minutes.
Right, exactly.
So I felt for them, actually. And so I'm glad that they've taken that step.
And we talked a little bit this morning about, the police department's going to be handing out masks this week. That event, I believe, starts tomorrow. And I don't know, do you have the schedule on that?
I don't, but we will here in a little bit. I'm glad you brought that up.
Yeah. I think they start in the morning with the people that are more at risk first, and then there's some other times it's out on their site.
Michelle read those off to me. I should have listened more, but I was glad that that's kind of one of those peer pressure things too, because some of the stores started doing the seniors early.
Right.
And I think it was a light went on. They go, that's a great idea.
Yes,
and so that's
exactly.
What they're doing.
It's a great idea. And again, just don't be out roaming around if you don't need to be out roaming around. I think is still the clear message, and socially distancing. And I've mentioned before, it's great to support your local restaurants. Go pick it up and go home and everything. But me personally, I'm not sure how soon I'll be sitting in a dining room, although I would love to. I would love to do that and have a nice margarita at Mexico Joe's. We have to use our conscience, and we have to do what's right for our community and not just for ourselves.
Right. And I mentioned before, seeing some of those restaurants, I don't think they were in Oklahoma. I think this was probably more like Georgia. But they were torn a little bit, and the extra work that they're having to go to and willing to do to make it, to follow all the rules. And some of them, I don't think their rules were as strict as, because I don't think all the restaurants were the same, but some of them were really going beyond the call to separate.
Yes.
And
that's great.
It is great. And so you feel for the extra work that those people are doing. And the guy, and I believed every word of it, he said, I have 10 employees, small place, and I need to take care of not only them, but their families.
Right. Yeah. Yeah,
and so they always had the mask, and every chair they were going to scrub down afterwards and stuff, and you go, wow.
Yeah, the store that I was in yesterday, it wasn't in Stillwater. It was in Edmond, and I had to go there to drop a computer off, so I wasn't just out shopping.
Yeah.
But I decided I needed groceries. I swung into Target, and they were wiping down every single cart. Again, I just needed a couple things, but it was really nice to see that they weren't leaving you a wipe to clean it. They were cleaning it for you.
That's what they were doing out at the last Walmart I was in, I think was the one on the west, the new one I call it.
Yeah, the new one.
But as soon as I walked through, there was a girl there, and she was spraying everything.
Right, how nice.
And then
That's
I
great.
still did get the wipe.
As well, yes,
yeah.
yes.
But it gave you because it was right there.
And the thing about it is I've always gotten the wipe and wiped my cart down.
Have you?
Even before this.
So were they always there?
They were always there.
See, I never even looked for them before.
Right, and I think, the one thing that we've all done is this made us aware that this isn't just about not spreading COVID, but, flu and other things that can be contagious.
Just the common cold.
Yeah, just it's good hygiene. We got really lax on that until we had to be really strict on it.
And I do remember the doctors coming in before, and, our hands have always been the biggest carrier.
Absolutely.
And just with the common cold.
Right. Yeah. Should we really have to put signs in bathrooms that say you must wash your hands?
Right.
No, you must wash your hands no matter who you are.
That's exactly right.
So yes, we definitely need to be diligent, continuing forward even after COVID, knock on wood, hoping that we get past that it does go away. But even with other things, you need to be using your hand hygiene and your social distancing, covering your cough, etc.
I've also learned I don't recognize a lot of people from the nose up.
I know that. It's difficult, isn't it?
Isn't it? Because you're going, especially if they're looking at you.
And sometimes I smile at them. I'm like, they don't see me smiling. But I've been told they can tell with your eyes if you're smiling.
I think they can.
So.
But it's amazing how many people you can't recognize. Some you can. But some you're going, that person looks familiar, especially if they're staring at you.
So a reverse of that is in the hospital world. You see all the surgical staff, and they usually always have caps on, even if they're not in surgery. They still have a surgical cap on.
Right.
When you see them and you see that they have hair, you're like, oh, you have hair. And sometimes it's completely different than what you think it's going to be. This one young lady I remember, first time I saw her without a surgical cap on, she had this beautiful long red hair, and I had no idea, for years, no idea what color her hair was.
Wow.
So, yes, we'll start getting used to looking in people's eyes more than and getting to know them.
And I think and I hope we're guilty sometimes of when something passes to go back to our old habits. I hope the appreciation for health care has gone up and the healthcare workers. I saw a thing, and this was a national story, but obviously New York is the epicenter, but they had people graduating early.
They did. To put them into service, yes.
And they were top of the line. I mean,
Right.
I think they chose the elite probably.
Yeah. Well,
but one of them was a 25-year-old, and it was his first day there.
Oh, bless his heart.
Can you imagine?
No, I can't imagine. And I will tell you also that, part of infection control in a hospital and the workings of a hospital, there's so many other people other than just nurses and physicians. Our environmental services team is crucial to preventing spread of infection by the way they clean, and so we value them so much. And if you may remember a few years back, we bought the zapping robots.
Yeah.
Those robots are being used all day long and into the night. We have repurposed employees that have been off work to come in at night and zap locations that we didn't normally zap: bathrooms, waiting areas, hallways, offices, anywhere else that we can use our machines, because those robots kill the COVID germs as well.
It seems like you've loaned that out to school.
I don't. We went and did a demo one time at the Wondatorium.
Okay.
We did a demo, and we do have one in case of large outbreaks that we could take to schools in the event that they had a large flu outbreak and that we needed to clean their building.
That's amazing, though.
So yeah, we would do that if there was a problem.
In the future, you think that'll be? No, I'm way down the future, but way may not be that far. Will that be a household type thing?
I wouldn't be surprised if they don't develop a
Why not?
size robot to kill germs. I mean, it's a UV light. It's a, I can't describe it very well. My friend Nesha Kimber would do a great job describing it. They're her babies. And, but yeah, I mean, I wouldn't be surprised if they didn't develop something for home use.
Yeah, want to make sure we get the word out that Stillwater Medical wants out today. And one of the things, because we're going to have the mayor on in just a few minutes, but talking about the different phases, and we'll learn kind of what those are going. I know they're still discussing that, and that'll be part of the meeting. But as far as elective surgery, that's been something I know people are asking a lot about right now. When are we going to start those?
So we are in the planning process. Just because they allowed or opening that up, so to speak, doesn't mean that it's just, flipping a switch and doing that. There's a lot of hoops to jump through in order for that to happen. We've been performing emergency surgeries. That hasn't stopped, and we do so safely. We have the proper PPE and et cetera. But to start elective surgery, there are some stipulations that we have to follow according to the governor, and one of them is that every person before their surgery has to be COVID tested, and the results have to come back within 48 hours of the surgery. So there's a balancing act going on there. In addition, the state's not paying for that testing, so we are working to contract with a lab currently that could perform those tests and get those back to us in a timely manner. So our surgeons have met every day. I think initially Dr. Crawley was going to be on the air today, but he's in a surgery section meeting this morning, which is, you got me instead. And so, there's a lot of people that have put a lot of work into making sure that we follow very specific plans. And, surgeries weren't stopped because they weren't safe. Surgeries were stopped initially because we wanted to conserve PPE. And, that's still a big concern. Right. We still know that this is not the end of COVID. This is not going to be that we're not going to see any more hospitalized patients. And we talk about gowns and gloves, and the numbers get reported to the state every single day of how much we have, how many ventilators we have, et cetera. But what people don't understand is the burn rate and how quickly we go through those. One COVID patient uses up to 50 gowns a day that have to be disposed of. So just because we say we have, several thousand gowns, it doesn't take very many patients in that state in order for us to be run out of those. And those are one of the hardest things to get right now from suppliers. The state doesn't have that many in stock. That's kind of our lowest denominator right now are the gowns. And so, again, we wouldn't have the supplies that we have if it weren't for the public stepping up and donating things to us and making sure that we had everything we needed. And we still really need cloth masks at the hospital because we are handing those out to everybody that goes in the door. And so if you don't give them to us, please give them to the police department so that we can get those out to the people that really need them. Very good.
You mentioned ventilators. Last week you and I talked about that before, and it seems like you mentioned you had 49 or something?
So a ventilator is not a ventilator. They're not all ventilators.
Right.
Capacity would be more what I would call it. The true ventilators that we use on a daily basis for other than just COVID, we have those, and then we have travel ventilators, and then we have their anesthesia machines. We do report those numbers every day but they can be MacGyvered, so to speak, to be a ventilator. Yeah. And so, there's a lot of things that have to be done to make those all into ventilators. But yes, we are in pretty good shape here in Stillwater.
What did the EMTs and stuff travel with? Would that be the travel van?
We do have travel ventilators, yes.
Okay.
Yes. So, and they're not, the capacity is, and I'm really the wrong person to ask about ventilators, but what I hear about it is the capacities are different.
Sure.
A high quality standard ventilator has levels of oxygen, whereas a transport ventilator is just a one solid flow of air. So
no, I think you're explaining.
I hope Mary Beth Hunziker. I apologize in advance if I've messed that up. But so a ventilator. There are definitely different levels of ventilators. Sure. So, but we are in good shape, and we feel pretty good about that. So, and we feel pretty good about the rooms that we have negative pressure air, and the thing about it is we still have to operate in the manner that that we could still get a huge influx of patients while at the same time trying to start up surgeries. So the PPE is the real issue here. Like,
right.
we want to make sure that we're completely covered and that everybody and every one of our employees is safely covered in the proper PPE. You know, our employees that are in surgeries and inpatient care, they're using proper PPE. They're not wearing cloth masks. Where you might see cloth masks in the hospital would be non-patient care areas and visitors and guests.
Very good.
Patients.
I know last time we had, and I'm sure you and I talked about this before, but I know Scott and I did, was about the fact that if you do have something that requires hospitalization, you have to see a doctor if it's a broken bone, if you're bleeding, if you think you're having a stroke or a heart attack.
Right. We are safely seeing patients now. I bet that's Christy, huh?
I bet it is Christy.
So yes, please do not ignore other health issues at this time, because, you know, we look at it and we're like, where's all the, you know, we always say GI bleeds that we normally have, the heart attack patients. Are they really not getting sick right now, or are they ignoring their symptoms right now and making things worse? So please, 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 if you have any kind of serious health issues, see your doctor. Doctor at their office, and many of our physicians and our urgent care have telehealth, and if you're an appropriate candidate for telehealth, they'll let you know, so give them a call. But, you know, there's nothing like a doctor being able to see and look at and you know, I use touch, but, you know, they feel your stomach, they listen to your lungs. Having a doctor that can put their hands on their patient is vital.
Telemedicine's also taking off and having a new life, isn't it?
It is, and you know, we hope that telemedicine will be able to continue, because right now it's an emergency proclamation, I believe, until June 1st, that telemedicine is acceptable for this, for right now. And so now there is definitely telemedicine out there, don't get me wrong, but what we have put in place is an emergency.
You were able to expand that, much like they did with the city council and the open meetings and all that stuff, right?
We did it overnight. They just jumped right on it and got trained, and it's gone very well. So
I'm going to get a legal ID in here, and then we'll bring Christy Morrison into the conversation.
Sounds great.
Here you go.
KOSB, Perry Stillwater. KOKP, Perry Stillwater. KOKP, Blackwell, Ponca City. It's Triple Play Sports Radio, your home for live and local sports talk.
There you go. I'll bring Christy in. Good morning, Christy.
Good morning. How are you?
You've already talked to Shyla, huh?
I have.
Great
conversation.
What'd you learn that we haven't learned so far here? We've learned elective surgery. You know, they're still all discussing that, and you'll find that out. But I know people are chomping at the bit.
They are. Right. And I don't know that everybody's chomping at the bit, but we sure would like to get the answer and have the plan out. But that's been a lot tougher to work on than just saying, hey, surgeries are open. So we'll get there. Hopefully today or tomorrow we'll have some plans in place.
And you did say you have meetings. I know you have meetings all the time. Mm-hmm. Did you do a lot of Zoom before?
Not really. No. We do a lot of Zoom now.
Yeah. Christy, you've done Zoom forever, right?
Yeah. Zoom, probably not.
But a form of that, yeah.
Yes, but a form, yes. But, I mean, the thing is, when you're talking to the person that does what I do for a living, the last thing I want is to hear people are going to do everything electronically now, moving forward.
With conventions and everything, sure.
Because we need people to want to meet face-to-face. That's why they come to Stillwater.
That's why they need to take the precautions for a while and get this thing nailed.
Right.
That is what makes me nervous, I'll tell you. It's like, oh, geez, let's knock it out now, because we sure can't have it come back in the fall.
Yeah, we need to hunker down.
Right.
Need to hunker down. That's really the message that everybody's conveying.
Right. And I mentioned it to Christy on the air earlier, you know, the mask thing, and we talked about this last week. The mask is protecting everybody else around you. And so do it for your family members, for your elderly community members, for anybody in your community. If you wear a mask, you are preventing, if you're asymptomatic and you're carrying COVID, you're preventing the spread of that by wearing a mask. So, you know, so just think about not just yourself, but everybody else.
Okay, I'm going to bring, he can't come in the room now because we got a rule, but Wayne Bovichin is in the building. Say hi to Shyla.
Hi.
And what's he wearing?
He's wearing a mask.
There you go.
Thank you so much,
Thumbs
Wayne.
Up. There you go.
He's been good about it.
Yeah, and a lot of people are. Most people are now.
Right. Hey, it's the thing. You can bling it up, whatever you want to do. Make it pretty.
That's what I asked if you were styling.
Yeah. So. Mine looks just like Wayne's. It's not real pretty, but it does the job. Just a standard mask.
Well, that kind of goes with Wayne, though. So, I could fall in that category, too. Christy, what do we want to get out there that's going on with Visit Stillwater? Because your site is kind of the messenger for the city as far as restaurants and all that stuff.
Yeah, it's going to be changing a lot this week because I can't even tell you how many emails and Facebook messages and text messages I've received over the past 2 days just from people who say, okay, our business is changing to this, we think, on Friday. So we're kind of waiting till after City Council meeting, and I have great faith in the fact that it'll be a little clearer, the message that'll be given out by our community as opposed to what happened on Tuesday, because that was really confusing for a lot of people, I think. So I think we'll know better after the meeting tonight what our future looks like May 1st moving forward. So that's going to help a lot of people, but I do think a lot of businesses are preparing with the assumption that they will maybe be able to open again on Friday, and then what that's going to look like.
Very good. And you can go to visitstillwater.org for that.
Yeah, that's going to just to let people know, that's going to be changing a lot every day, particularly after tomorrow. So also, if you own a business, please let us know that your hours of operation will change, or the manner in which you can provide service is going to change, because we definitely want to help get the word out about that as much as possible. And that's for dining and retail and all those types of businesses.
That sounds great.
Very
good.
Okay, I'm gonna take a chance here. Okay, because we have Christy Morrison on one line, and she's with Visit Stillwater. Shyla Eggers with Stillwater Medical Center, and we're gonna take a break, and then we'll move on to the mayor, who's in the next segment.
Okay.
But the mayor is here. Do you have a question for either one of these young ladies? Good morning, Will. First of all.
Good morning. How are you guys?
Hi,
Doing
Will.
great.
I like the young part.
I don't have a specific question right now, but I do want to say thank you so much to the staff of Stillwater Medical, the staff of Visit Stillwater. All of you guys have been just amazing over the last few weeks, getting information out, of course, treating patients and handling the medical side of it at the hospital. But the Visit Stillwater team with keeping people informed on what's open and what's not, and how to support local business. Just been so impressed with both of those organizations and so many other people here in Stillwater, stepping up and pitching in and figuring out how to help.
Well, I will tell you, I'm going to chime in for both of you. This will be, we've had so many businesses locally reach out, do nice things for us, provide meals, and our employees have said, hey, we would like to get a comprehensive list so that we can support these businesses when they open back up. And so, so our 1,700 plus employees have noticed those businesses that have reached out to do something for us locally, and really, really want to support them. So we can't thank all of them enough, because it's very, very touching for them to during their time, this very slow time for their business, for them to want to do something nice for us. So. And also, we really appreciate, I told Christy on the air this morning that our mayor is so proactive in the fact that he wants to protect our community just like we do, and we communicate with him often, and it really is about, it's bigger than just one person or one business. It's really about keeping everybody safe and at the same time saving your city, so to speak. Kind of hard to, you don't want to encourage people to start migrating outward because everything else in the world is open, but we have got to just be diligent and be safe.
And this would be for probably all of you, but primarily probably for Will. But in watching David Holt speak the other day,
that was touching.
The emotion in his voice, which was 100% real, and I think you understood the weight that is on the shoulders of some of these folks. And
Absolutely.
Mayor Joyce has had that responsibility here. And to see I thought the total honesty and transparency, he didn't plan on that. And I thought he did a great job, but you could hear it in his voice. And I thought that is the definition of what we're going through right now.
That's a definition of a leader.
Absolutely.
And Will's done a great job.
So yeah, his speech on Friday was really great, and I was tearing up watching him tear up, just because I do understand where he's coming from and the decisions they've been trying to make and trying to figure out what's the best way forward, and I think we've all kind of realized here over the last few weeks that there's not there's not a one right answer to most of these questions, and there's so many different factors that are involved that it becomes very difficult to figure out who to listen to and what to listen to at any given time, and you have that responsibility to try to do something, but it's also difficult to know what that right thing is. And so, but like you said, I think that applies whether you're the mayor or you're running a hospital or you're trying to get your kids, educated
Right.
At home, or you've lost your job because the employer has shut down or whatever it is. I think we've all had those times where we've had to figure out, how do I go forward from here? And it's been taxing on all of us, and I think like you said, we've still got some time to continue to fight this and to stay strong and continue to make every effort we can to keep people safe. But that changes every day, and figuring out what the right thing is today is the best that we can do.
Anyway, I think I heard Christy there too when I mentioned that, the fact that I think you must have seen the mayor also, right?
Yes, I did. I watched it live. Actually, I think it was live, but anyway, I had to watch it again because it kept kind of buffering.
Yeah.
And I thought, wow, it was hard to watch twice because, your heart broke for him because, he cares for so many people. But what I liked about it is the message was very clear-cut, and you understood exactly what he was saying and where he was coming from. And that's what I've loved about what Mayor Joyce and our city has done is in my opinion, I've never questioned what anything meant. They are very good about communicating where we are and what we're going to do moving forward and what the expectations are, and I think that's what alleviates a lot of the angst, is just having a clear message, and they've done such a good job at that.
Well said, and I think the communication is a key. But when he said he didn't take that lightly, I think Mayor Joyce has also posted that exact same thing a couple of weeks ago, that these aren't taken lightly. You want to help you, but you also want to help you. Mm-hmm. And how do how do you cover everything? It's impossible. And so,
well, he's definitely made lots of calls. I've been the recipient of many of them, and I know that it's weighed on. Well, I know it's weighed on you immensely, trying to do the right thing for the community, and I feel like everybody has definitely done that. So, congratulations to you and everybody else in the difficult position of doing that.
Yeah, I appreciate that, Christy, and it's tough at this point to sort of say what we've done is to see what the impact has been. I think we've made good decisions. I think we've done the right thing in the way we've acted to this point. It's getting a lot harder right now to know if that's the right thing, right? To this point, I feel like we've been able to make decisions that we feel are most beneficial to our community. But as Mayor Holt and Mayor Bynum both said in their conferences on Friday, there are now external factors that are sort of pushing us in directions that we're not sure are the correct ones for our communities, and that is, I think, what's made it so much harder over the last few days. Is just that it's not we've not been able to sort of go, okay, this is what I believe is right for our city, and we're gonna go forward in this direction. Now we've got some external factors that are steering us and kind of pushing us away, I think, from what we really might feel is best for our communities. And so now, we're trying to balance all of that and figure out how to shoot somewhere down the middle, from where we really want to be and where we're being pushed to be. And I think, that's a big part of why you saw that emotion from Mayor Holt. And, in our decision-making here, it's been very similar. My calls on Thursday and Friday last week were much, I think, even more sort of emotional and sort of angsty in terms of trying to figure out what those right things are, because there's just so much more, sort of external and outside pressure that's being applied to try to figure out what we should do locally.
That's why I really appreciated Shyla earlier really mentioning the mask again, because, if we put the brakes on now,
right?
Because you're getting kind of mixed messaging a little bit, and the fact that, it's over.
Yeah.
They said we can go back.
It's not over.
That's why I think the emphasis on the mask, and we'll do that in our next segment and stuff,
Absolutely.
is really important. So
Yeah.
so I appreciate that.
Yeah. Wear a mask. Protect your neighbor.
There you go. So,
Amen.
Christy, anything before we let you guys
Nope.
go with this train? I appreciate you calling. I know you've got a full day too. So
Sure, no, that's okay. Just go to visitstillwater.org, check out the information there, and then please keep us in the loop about your particular business so that we can get out the correct information for you moving forward.
there you go. There's Christy Morrison, who is the Executive Director of Visit Stillwater, Marketing Director for Stillwater Medical Center, and Shyla Eggers. Any final note from you?
No, just keep on keeping on. Let's just get this thing put to rest.
That's it.
Do
Let's
the
whoop
right
it.
thing.
Right.
Yes.
Yeah. And Mayor, you're going to hang around a little while, so
I'll be here.
we've only just begun. There we go. We're quoting 70 songs now.
Oh, awesome.
There you go.